Live now to Canberra, where the Deputy Chief Medical Officer Paul Kelly is giving an update.
People expressed in those protests yesterday and are expressing in other ways over this matter. I certainly also would like to say that myself and the Australian government absolutely understands the democratic right for people to protest about things that matter to them. In the lead up to the protests, though, that happened in several of the major capital cities yesterday, there were strong messages from state governments as well as from the Australian government, the Chief Medical Officer and Chief Health Officers in various states. We were all at one in relation to that, and the Australian Health Protection Committee put out a statement on Friday suggesting strongly that people did not go into what we would call a mass gathering in the streets yesterday. And that was for reasons that we're concerned about how infectious this virus is and how it can spread very quickly from person to person in close contact. The other element of a mass protest or a mass gathering of any sort is that it does bring people from widely dispersed parts of a city or a state that may not know each other into close proximity, which allows that virus to spread from person to person and then for people to widely scatter within the city or the state. This is of concern. If there was someone in one of those large protests yesterday with COVID-19 they were infectious, that infection can rapidly go to other people and those people could become sick over the next week or two right around many parts of the cities or the states. So this could spark an increase in the number of cases, and this is what we were trying to avoid. So it happened. We are now having to wait and watch. We've talked about vigilance here before, that cautious approach, that alertness we will need to take and really watch out for cases that may occur in the next week or two around Australia. My message to people that were at the protest yesterday, and this is not a blame game at all, that was a decision made and the protest happened. We can't roll back time. But anyone who was at the protest, it's the same message we have for all Australians, but particularly for people that have been in mass gatherings in the last couple of days. If you do get sick with symptoms that we've talked about a lot, cold and flu-like symptoms, it could be COVID, please get a test as soon as possible so that we can know that that is the case and start the process of contact tracing to try and decrease any outbreak that may occur. There's no need for people that were at that protest to get a test unless they are sick, but if you are sick, please get a test quickly and stay at home until that result is available. This will protect your life, the life of your families, and lives further into the community. So I'm going to leave it there, and I'm happy to answer questions.
Do you agree with Matthias calling this self-indulgent, given that the message did go out, please not go, and people just defied that? Do you agree that's a fair categorisation?
Well, of course, the ministers can have their own views. My own view is that it's unfortunate that this mass gathering happened, but I understand why it happened. The issue now is that we are on more of an alert than we would have otherwise been, and so we'll just have to keep watching. And that message, please, if you get sick, get a test, and then we'll know.
Do you have an idea of how likely it is that in a week or 2 weeks we're going to start seeing a spike in cases? Would you say that actually is likely given the scenes we've seen over the weekend?
Well, the first thing that needs to happen for this to be a problem, of course, is for someone who was infectious with the virus to be amongst those groups. Now, we know that there have been very few cases in Australia out in the community over the last few weeks, but there have been cases. There have been cases and several small clusters of cases in Melbourne. There has been a new case diagnosed in the ACT this weekend and in Queensland, the first of those for some time, and in New South Wales, not so many recently, but there are cases out there. So what is the chance of a group of 10,000 or 20,000 having someone who was infectious in there, it's certainly more than being evenly spaced away from a small group of 5 or 10 or 20, as is our current recommendations in most states.
Professor Kelly, the AHPPC's advice prior to the protest conceded that contact tracing would be pretty impossible with so many strangers gathered together. What value, if any, could the COVID app be? And if it can't help us contact trace if there is a cluster, what's the point of it?
The COVID Safe app would be absolutely critical and crucial in this type of setting. It's exactly what it's designed to do. Is to pick up cases when you don't know the people around you. Unfortunately, we don't know how many people that were at the protests might have had the COVID Safe app on their phone, and so it would rely on that. We've had a very good uptake of the COVID Safe app, but the majority of people that have mobile phones have not downloaded the app so far. So I certainly would encourage people to reconsider that, because this is exactly how it would be helpful.
Just continuing that, given that it's possible there might be more protests, more gatherings on this issue going forward, the level of personal responsibility here, we saw some with masks, many without. What kind of personal measures would you expect those protesters to be taking if they're going to breach the health orders?
So I was encouraged to see the masks yesterday. Well, we hope that the protests wouldn't go ahead, or that they would be very small. Those people with masks on were doing the right thing in terms of when you're in a situation where you can't physically distance, it may have some benefit. But look, I think the message will remain from the AHPPC that we would prefer that people found other ways to protest about this matter, recognising that it is an important matter and people are very strongly concerned about it, and I totally understand that. But further protests of this nature will increase further the risk of the COVID-19 pandemic continuing.
Deputy Chief Medical Officer Paul Kelly there, saying that it is now a case of having to wait and watch to see whether yesterday's Black Lives Matter protests cause a spark in the number of COVID-19 cases across Australia.